Dzień za dniem, noc za nocą, nasze życie upływa pod bezkresnym niebem. Marzymy o rzeczach wielkich, ale życzymy sobie rzeczy prostych. Myślami wybiegamy do przodu, ale jesteśmy świadomi, że życie toczy się tu i teraz. Spoglądamy w niebo z dobrego miejsca na ziemi.
Minęła godzina 9:45, a więc czas na kolejną lekcję języka angielskiego. Witamy bardzo serdecznie pana profesora Macieja Doksę.
So to those who were watching our first lesson today, welcome back, and good morning to all those who have just joined us. So before the break, at the end of our first lesson, we have asked a question: is there and what is the treatment for coronavirus infection? And the possible alternatives were antibiotics, chemotherapy, aspirin, steroid injections, czyli zastrzyki ze sterydów, surgery, meaning operation on your body, vaccine or vaccination. What is vaccine? Well, vaccine is this kind of substance that you get before you become infected with the disease, and it helps your body to become immune, to develop immunity to the disease so that you don't get the disease in the future. In Polish, vaccine means szczepionka. Vaccination, szczepienie. Or maybe we can just take throat lozenges. Throat lozenges are those rather big tablets or pills that we put into our mouth when we have a sore throat, and we keep them in our mouth and suck on them so that it helps us to ease the pain of the sore throat. Or maybe we should take just a cough syrup and it will help us. Or maybe the best idea is to take a cold remedy or flu remedy. What are remedies? Well, remedies are those substances, those medicines which actually help you with the symptoms of the disease. They usually do not cure the disease itself, but they help you ease the symptoms to make you feel better. They will lower your temperature, they will act as painkillers, they will unblock your nose. There is a lot of them in the market nowadays. You can buy them without a prescription from a doctor. So, what is the answer to this question? Well, the World Health Organization doesn't have good news this time. So according to WHO, there is no evidence that current medicine can prevent or cure the disease, which means there is neither a vaccine for the disease or any medicine, any drug that we can use when we already catch the virus that will help us to recover, to become healthy again. Researchers are working on it, but so far they have not found a vaccine or a drug to kill the virus. So WHO does not recommend any self-medication with any medicines, including antibiotics, as a prevention or cure for COVID-19, which means when you have the symptoms of coronavirus infection, it is not a good idea, according to WHO, to take any medicines on your own, to take it yourself. You have to just see a doctor, get tested, and then do basically what the doctors tell you to do. Antibiotics actually do not work against viruses. This is a universal truth, so all the viral infections cannot be treated with antibiotics because antibiotics only work on bacterial infections, so infections which are caused by bacteria. COVID-19, as we all know, is caused by a virus, the coronavirus, so antibiotics do not work. Antibiotics should not be used as a means of prevention or treatment of COVID-19. They should be only used as directed by a physician. Physician is another word for doctor, to treat a bacterial infection. Okay. So what about prevention? So can we prevent catching the disease or prevent developing the symptoms of the disease? So in other words, is there a vaccine, szczepionka? Unfortunately, not yet. To date, meaning until now, there is no vaccine and no specific antiviral medicine to prevent the disease or to treat the COVID-2019 disease. However, those people who already are sick with the virus and meaning who are affected, they should receive care to relieve the symptoms. People with serious symptoms, with serious illness, should be hospitalized. Most patients recover thanks to supportive care. What is supportive care? Supportive care is not actually a treatment which kills the disease, but it's a medical care that you get to help your body fight with the disease and to win, to beat the disease and to help you recover. So what could be the examples of the supportive care? Well, for example, in hospital, they can give you some fluids in the form of a drip, which is kroplówka, or if you have problems with breathing, they will put you on a ventilator. Ventilator is respirator in Polish. Or they will give you some oxygen to help you breathe and to make your breathing more effective so that your body gets enough oxygen. Oxygen, tlen. However, well, although there is no drug against the virus and there is no vaccine to prevent the development of the disease, the possible vaccines and some specific drug treatments are under investigation, which means researchers all over the world are testing them in clinical trials. Right now, as you can read in the news, all over the world there is a race to find either a vaccine against the disease or to find a drug that will help us recover and that will prevent people dying from the disease. All right, so as we said before, the disease is extremely contagious. It's spreading like wildfire. It's spreading very, very quickly. So it is quite possible that a lot of us will finally become infected with it. So next question, an important question is, what if we actually feel that we have any of the flu-like symptoms mentioned above? What if we actually think that we might possibly be infected with the disease? Well, the doctors say that if the symptoms are mild, so not very serious, if you're generally feeling not so bad, you don't feel very sick, you should stay at home, get plenty of rest, plenty of sleep, take care of yourself, eat good food, and try to make your body strong to beat the virus. Of course, to prevent spreading the disease, to prevent infecting other people around you, you should not leave home. You should be in quarantine or isolation. Stay at home for at least 14 days. That's what is recommended. However, if you feel that your symptoms are getting worse, if you have a high temperature for a longer time, if you have continuous, so non-stop dry cough that doesn't go away, that doesn't disappear, that is getting worse, or if you have problems breathing, you cannot breathe properly, then you should contact emergency services, medical services, and get medical help. Do not try to, cure yourself, to act on your own. Get medical help. This may be serious, so you should probably go to hospital. All right, so let's summarize the things that we have talked about today. The vocabulary that we have used to describe the coronavirus disease, to describe its symptoms and things which are not the symptoms of the coronavirus. So in this table you have all the words, the important medical words that we have actually used today. So let's just take a look at them and repeat what we have hopefully learned today. So, a vaccine. Vaccine, as you can see, szczepionka. So this is something that prevents the development of the disease. Is there a vaccine for coronavirus? Of course, not yet. There probably will be. They are working so hard on it that I cannot see a reason why it should not be discovered. It is only a matter of time, and actually a question of time. When? Well, the sooner the better. Contaminated, which means skażony. Things, organisms can be contaminated with viruses, with bacteria, with chemicals. Of course, in this case, with coronavirus, people or objects around us can be contaminated with the virus. That's why we should avoid touching objects around us. We should not actually shake hands with other people. We should wash or disinfect our hands as frequently as possible, because they may be contaminated. Symptoms, objawy. We have been talking about the symptoms of the coronavirus disease today, the most serious ones being high fever, which doesn't go away, dry cough, continuous dry cough, which doesn't go away, problems breathing. These are the most serious symptoms. Of course, there are others that we have mentioned, like sore throat, diarrhea, not very often, but some cases have been reported, feeling tired, some aches or pains in the muscles. So basically, these symptoms are very similar to when you have flu. That's why they are called flu-like symptoms. Dry cough, suchy kaszel, again one of the main symptoms of coronavirus. Pneumonia. Pneumonia is a consequence, is a symptom, and at the same time a consequence, very serious consequence of coronavirus infection. It is a viral pneumonia, which means it's caused by virus, not bacteria, which makes it more difficult to treat because you cannot actually use antibiotics. You just have to wait until your body beats the virus and beats the pneumonia. Sneezing, it can be one of the symptoms of coronavirus, but as we said, it is especially dangerous because it helps to spread the disease. When you sneeze, you spray, you know, the virus that's in you all around, and that's why the surfaces around you or people can become contaminated. When you develop serious viral pneumonia because of coronavirus, you will go to hospital and they will put you on a ventilator. Ventilator in Polish is respirator. This is probably one of the most, if not the most, wanted machine all over the world right now. Companies are trying to produce them as many as possible, as quickly as possible, to deliver them to hospitals. Because unfortunately, right now, in some countries like in Italy, you know that there's more people who need the ventilators than the ventilators themselves. So it is an extremely important machine or device that helps people to survive the disease. Antiviral drug. Drugs are not only narcotics. Drugs in English also means medicines. So antiviral drugs, as you can see, like antivirusowe, these are drugs which actually, or medicines which actually kill the viruses. Unfortunately, there is no antiviral drug proved to be effective against coronavirus right now. They are working on it, they're trying to develop it, but there isn't one that we can say kills the virus 100%. Cure. As we said, unfortunately, there is no cure for coronavirus right now. Cure is generally anything, a drug or treatment or whatever, something else that helps you to get healthy again, to recover. There is no cure for coronavirus so far. Surgery. Operacja. We know surgery is not one of the ways of helping the patients with the coronavirus. This is for other things. As we said, coronavirus is extremely contagious or infectious. Zaraźliwy, zakaźny. It means you can catch the virus easily. It's very contagious, very infectious. That's why we have to keep the distance, keep the social distance, social isolation, wash our hands because it is so contagious. Treatment, leczenie, treat, leczyć. As we said, there is no effective treatment against coronavirus right now. You cannot treat this with antibiotics or any other drugs or medicines. You can also use supportive treatment or care, which means you just help the patient to stay healthy or stay alive. Physician, that's an interesting word. We usually use the word doctor in English, and most people are familiar with this word. However, especially in America, a doctor is also called a physician. So physicians, I think we should all help the doctors, the nurses, the paramedics, physicians who are on the front line of the battle with the disease. So these are the people who are right now in the middle of this, you know, very, very difficult battle. Vomiting, not a nice symptom, not a nice thing. As we said, it's not really a symptom of coronavirus infection. Tiredness, so being tired, zmęczenie, yes, It's one of the flu-like symptoms. So tiredness plus other symptoms can possibly mean you've got the disease. Nasal congestion, which means blocked nose. Yes. So it can also mean the same as runny nose. You cannot breathe through the nose, it's blocked. There is some liquid getting out of your nose. It can be a coronavirus symptom. Throat lozenges, tabletki na gardło. Yes, so of course you can take it to kill the pain in your throat, but it doesn't really kill the virus. Cough syrup, as we said, it can help you when you have this dry cough. It can help you to relieve the symptoms. You maybe feel better, but it doesn't kill the virus again. Cold remedy, so these are all the medicines, let's say, which you can buy without prescription when you have a cold or flu. They will help you feel better, lower your temperature, unblock your nose, kill the headache. Lungs. Lungs, this is the organ that is mostly affected with coronavirus. If you have pneumonia, zapalenie płuc, pneumonia is actually the serious disease of your lungs. It can be caused by bacteria or the viruses. Disease, illness. Of course, this is obvious. That's a situation when you get sick and the kind of sickness you have is your disease or illness. Coronary disease, choroba wieńcowa, so this is the disease of the heart and all the circulatory system, the veins. It is, as we said, one of the risk factors. When you catch coronavirus, it can make your symptoms really bad. Cancer, also one of the risk factors which can make your disease much worse, your symptoms much worse. Diabetes, cukrzyca, again, unfortunately, another risk factor which means that your coronavirus infection can get pretty bad. Overweight or obese, these two words mean more or less the same, otyły. There is a tiny difference. Obese means that you are fatter than overweight. It's just actually worse. Yes, it's more serious when you're obese. So being overweight, being obese can be another risk factor because it is quite often connected with other underlying diseases or health problems like diabetes or coronary disease, for example. Diarrhea. As we said, it can be, not very often, but it can be one of the symptoms of coronavirus infection. There have been some cases reported of people suffering from diarrhea. Rash, wysypka, that's not really a coronavirus symptom. Dizziness, zawroty głowy, well, this is not reported, hasn't been reported as a coronavirus symptom, but it, of course, it can accompany other symptoms. Generally, if you feel unwell, if you're really sick, you can also feel dizzy. Swollen ankle, spuchnięta kostka, of course, we know that this has absolutely nothing to do with the coronavirus disease. Aches and pains. Yes, this is one of the symptoms because, as we all know, this is also a flu-like symptom. You feel muscle pains, your body aches or hurts all over, so that might be a symptom of coronavirus disease. Okay, and finally, I have prepared some medical vocabulary quiz. So, your job is to complete the sentences using the words that we have used today, that we have learned today, that we have just discussed in this table. So, the first sentence is pneumonia, zapalenie płuc, is a disease of which organ? 2. Most common symptoms of coronavirus infection are. Okay, so these are the two most common, most serious symptoms. Other symptoms include, yes, so these are the less serious symptoms, maybe less common, but they also are reported as symptoms of coronavirus infection. Some patients may even have, and that's another symptom that is not very common, but it happens, very unpleasant, but as we said, it can be a coronavirus symptom. COVID-19 patients with severe pneumonia are put under a, yes, what's the name of this machine that is used to save lives of people who develop severe coronavirus infection? Researchers are working to develop, yes, so what are the researchers all over the world working on right now? What do they want to develop? Two things, yes? The next question, when you have a sore throat, you take, yes, what do you normally take when you feel pain in your throat, when you have sore throat? What is this thing that you put in your mouth? When you have a cold, you can take what? What do we often take when we feel bad, when we have a flu or when we have a cold and we, for example, don't go to the doctor, we just want to buy some medicines ourselves. So what do we buy and what do we take? And the last question, obese people more often suffer from, yes, from what kind of disease? What kind of disease is not always, but quite often connected with being seriously obese. Okay, so I will give you just maybe 1 minute to take a look, think about it, and then I'll tell you the answers. Okay. All right, so let's see the answers. Pneumonia is the disease of the lungs, of course. Yes, the two organs or pair of organs which are infected with bacteria or viruses when you have pneumonia. The most common symptoms of coronavirus infection are cough, yes, dry cough, and fever. Other symptoms can include a sore throat, of course. They can include, yes, I have actually forgotten what I have put here. Okay, let me think. Let's move on to the next one and I will come back to this one. Some patients may even have diarrhea, of course. As we said, unpleasant, not very common, but it happens. COVID-19 patients with severe pneumonia are put under a ventilator. This is the life-saving machines that help you breathe if you are unable to breathe on your own. Researchers are working to develop what? Well, a vaccine that could prevent the spread of the disease, make us immune, or cure for COVID-19. So any medicine, drug that will help us kill the virus if we have it and help us recover. When you have a sore throat, you take a throat lozenge. These are, of course, the big tablets, yes, that you put in your mouth and you suck on them. When you have a cold, you take cold remedy. These are the popular medicines that we can buy without prescription. A lot of people use them. I would personally say we tend to overuse them, but that's the reality. Obese people more often suffer from diabetes. As we said, not only there are different types of diabetes, but statistically, unfortunately, they suffer from diabetes more often, and that makes them a risk group. And the second part of our vocabulary quiz. So a twisted ankle is usually what? I mean, what does it look like? Smokers frequently suffer from lung. Yes, from what kind of disease do they suffer? One of the symptoms of food allergy is what? For example, you're allergic to strawberries and you eat strawberries. What will be a very possible symptom of your allergy? What do we call a disease which is a disease of the circulatory system? The next sentence, what is another name for a doctor, which is especially used in the USA? Next one, common symptoms of a cold are nasal what? What do we call, what is another more formal name for blocked nose? And another symptom of the cold is also connected with the nose. And the last sentence, viruses can be killed only by what kind of drugs? What do we call the drugs or medicines which kill viruses? Okay, I'll give you just half a minute to think about it, look at it, and then I'll give you the answers. All right, so a twisted ankle is usually swollen, of course. As it gets bigger, so we say a swollen ankle. Smokers frequently suffer from lung cancer. Unfortunately, that's a direct cause of smoking. One of the symptoms of food allergy is a rash, so you get this usually red spots on your skin, which we call a rash, czyli wysypka. Coronary disease is a disease of circulatory system. Yes, in Polish, choroba wieńcowa is the disease of the heart and the veins, żyły. Another name for a doctor, physician. Common symptoms of a cold are nasal congestion, so blocked nose, and sneezing, kichanie. Viruses can be killed by antiviral drugs. Antiviral means used against viruses. And I think I owe you the answer to this one. Other symptoms of coronavirus infection can include, of course, pains, aches, and sore throat. All right, so that's all for today. I hope you have learned a lot. I hope this will help you with your and our fight with coronavirus and other diseases. While preparing this lesson, I used the medical information that is presented on the website of World Health Organization, as you can see here. Thank you for your attention.
Bardzo serdecznie dziękujemy. To była lekcja języka angielskiego. Oczywiście pan profesor Maciej Doksa zostaje jeszcze z nami, bowiem o 10:30 rozpocznie się kolejna lekcja, tym razem dla klas drugich Liceum Ogólnokształcącego. A więc zapraszamy gorąco. Dziękujemy panie profesorze.
Dziękuję bardzo.